people, don't we? If you go to England, if it was genes, why aren't they all dying of heart disease there? Why aren't they dying of cancer? It's not your genes. Let's go over to the Amish. Does anyone know the studies on the Amish who live in the United States? Are they Americans? The Amish don't have heart diseases. They don't have these diseases. And then we start studying the Okinawans. The Okinawans have the same high risk as we do, same genes as we do going through, yet they don't die as fast as we do as Americans. So let's look at Okinawa. Why? Because Okinawa right now has some of the oldest living people in the world right now is still in Okinawa. Over 120, 115, 125. And at 125, they're not sitting in a nursing home there. This is the older Okinawa, just so you know. If you study Okinawa now, the 30 and 40-year-olds are getting cancer there. Does anyone know why in Okinawa it's happening? Because what they bring over there now? They brought McDonald's over to Okinawa. They have fast food in Okinawa right now. They didn't have it in the older generation. The older generation still doesn't eat those things because we have a military base over there. When you have a military base, Americans come over there and screwed it up. That's literally what happened. But right now, if you look at the older population of Okinawans, U.S. has 4 times the deaths from lymphoma, 5 times the deaths from heart disease, 6 times the deaths of breast cancer. The older Okinawans, over 90 to 95, 1% die of heart disease and cancer. 1%. Something's wrong with what we're doing. 84% of Americans die of either heart disease and cancer now. Is it genetics? So some of the centenarians, those of you know, the 100-year-olds in Okinawa, did not possess low-risk genes. They possessed high-risk genes. They had the genes. They have the genes. It's not your genes, it's how you express them. Your genes can be turned on or off depending on how you live your life. You make the decision to turn them on. If you want to turn them on, you will, and if you don't, you won't, living your lifestyle. In fact, some had high-risk genes. Therefore, they still remain slim, healthy, robust, full at 100 years despite bad genes or absence of good ones. So do you have the potential? Don't blame your genes. Don't blame your parents. Don't blame anything else except for who? You are responsible, 100% responsible for everything. If it was genes, then everybody in your family would get it. If it was a gene, how come a gene's getting turned on when your mom was 30 but when your sister was 70? You know, it doesn't make any sense. Like, why is one gene turned on at one age? If it was a gene, they would all be turned on right when you turn 30 on your 30th birthday at 7 o'clock. Does that make sense? If it was a gene, then it would turn on all the same time, wouldn't it? It's not your genes. It's whether you turn them on or not. Some people don't turn them on until they're 80 or 90. Some people turn those genes on quicker. So let's go through right now what is heart disease, because this is important before we get into preventing it and reversing it. You have to know exactly what is it. So heart disease is just a general term. It's used to describe several different conditions. It's a disorder, any disorder that affects the heart's ability to function normally. Anything that affects your heart is considered some type of heart disease problem. Whether it's an arrhythmia, whether it's blocked arteries, no matter what it is, cardiomegaly, enlarged hearts, that's all parts of heart disease. Heart attacks, strokes, congestive heart failure, arrhythmias. Those are all examples of anything. Anything that blocks the heart, slows down the heart, or interferes with the heart is considered a heart problem. So what's the cause? Obviously, the most common cause of all heart disease is narrowing or blockage in the coronary artery that supplies your heart. Everybody knows that, right? That's what we're worried about. If you go for a test, what are they going to look at? They're going to look at your arteries to see if they're what? Blocked or not blocked. If your arteries are blocked, they know that what's not getting to your heart? Blood, and what's going to happen? You will have a heart attack. And then if that little piece of plaquing breaks off and goes to your brain and blocks blood to your brain, what do you have? That's a stroke. And so are those things dangerous? Yes, very, very dangerous. So we want to figure out what is it exactly, how do you reverse that, how do you prevent that? Your amazing heart. I mean, the heart is amazing. You have no idea. It's pumping blood. It's pumping millions of gallons throughout, literally within months. Millions of gallons are getting pumped from your heart throughout your whole body. And so we have the heart goes right over here. This is the inside of your heart right here. Above it are all of your arteries. Everything is feeding the heart. It's blood, and it's going back and forth. In, back, out, through. So obviously the heart is the pumper, and it keeps the blood flowing through the body. Obviously very important. Not as important as your brain, but it's the second most important organ of your body. Everybody knew that, right? What controls your heart? Your brain. It's your brain that runs the heart. Your heart is the second most important area of your body. So here we go. Top is showing you a normal artery. Open artery flowing right to the heart. Clear, blood can get through there. You can see B, that's a narrowed artery. It's starting to inflame in there. Decreased blood flow. We can see here a totally occluded artery. That's about 90-95% occluded right there. When they run a test on you, they're looking at the blockage in there. And so when you see children, they already have the plaquing or streaks. Not always the whole thing is plaque, but there'll be little plaque streaks already starting to interfere. Could be 10% blocked, 20% blocked. Some of you already are 60 or 70% blocked. That's what we're looking through. When you look through the artery this way, it should look just like that. Your artery should be nice and open and getting through. This right here is inflammation or swelling or plaquing that's beginning to fill up inside the artery. And this is severe inflammation and scarring in there. So Mythbuster, high cholesterol causes heart disease. Who thinks that? That's why most of us are here. Who thinks it? Almost all of you think it. Who told you that? Your doctors did. So no question. And everybody says, I don't know if I believe it. Yes, you do. To go throw your drugs away, right? I'm not telling you you wouldn't, because you still think cholesterol causes heart problems. You think cholesterol is what causes the arteries to clog. Yes? That's what we think. 90% of this room probably thinks that. So that's what we need to get through first so you can understand this. Because right now we know that if taking cholesterol drugs and lowering cholesterol was working, we wouldn't have as many heart attacks. Yet we have more. We have more people on cholesterol drugs ever in history right now. You have people with like last year would have had a good cholesterol, this year they consider it bad, and they're even on cholesterol drugs. Everybody's on a cholesterol drug over the age of 60, yet we have everybody dying of cholesterol and heart problems. So high cholesterol causes heart disease. Myth. First thing we need to figure out is, what is cholesterol? Has your doctor ever explained to you guys what cholesterol actually is? He's explained it to you and sat you down and said, here's cholesterol. I'm still not understanding this. This is your life here. And you're about to put on a drug that's very dangerous, and no one sat you down and done a class. All they do is they can have my PowerPoint, and they can show you how to do this and what the cholesterol is. What is cholesterol? It's a soft, waxy substance that is made by the liver. So right away we know your liver makes cholesterol. And everybody knew that, right? Your liver makes the cholesterol for the body. Right away we go, okay, if my liver is making cholesterol, the first thing we have to ask ourselves is, why does it make cholesterol, right? What's the reason for that? Because who created our body? And so God created the liver to do something and create cholesterol for what? For a reason. For a reason. It travels. So cholesterol travels in the blood as two compounds. And this is what you guys know. Low-density lipoproteins and high-density lipoproteins. So you guys know that. There's two types of cholesterol. We're going to explain that in a second. Cholesterol, now listen to this. We just explained it. Why would God make cholesterol? Why would your liver produce cholesterol? Because cholesterol is needed to manufacture hormones, bile acid, and vitamin D. Important stuff? Very important stuff. Vitamin D synthesis, we know if you don't make vitamin D, your chance of cancer is increased by like 24 to 30%.